Hi folks, I know we promised you a weekly update on what we're doing at the practice with the lockdown and the way we're working. We decided to do this week's one a little bit early on Friday just to give you and our team time to prepare for the changes we've made. So we've been giving you regular updates ever since the UK went into lockdown, and as of Monday just past we decided to do weekly updates in the form of one of these videos and some text on Facebook. Here at Apex Vets, we've started stringent restrictions and measures from even a week before the UK went into official lockdown, and of course the reason is to attempt at least to keep our team and you, our clients, as safe as possible from this virus. Glenn and I were watching last night's update from the government very closely. We've had long discussions with the team this morning. It's become apparent that the lockdown in the UK is going to go on for a good bit longer than the first 3 weeks that was announced. That could run on into months. So we find ourselves in a position that 3 weeks ago there were certain things that we didn't call urgent. That might be a vaccination or a neutering procedure. As these weeks and months roll on, some of those procedures are going to become more urgent, in that, if they're not done in a timely fashion, we could risk our patients becoming unwell. So Glenn and I are in a position that we need to balance the government's advice, which is for you to stay home, protect the NHS and save lives, versus now the needs of our patients, which if we leave these patients for too long without treatment, they might become unwell. And we're trying to tread that line as carefully as possible. We're also acutely aware that there are puppies who form part of our client base that need to get out socialising very soon, otherwise they're going to risk behavioural problems as they get older. So over to Glenn for the changes for next week.
Okay, so as Douglas was saying there, looking after our staff and our clients is still really important for us, but there's a number of procedures we're now going to go ahead and start performing as of Monday morning. I'll go through those just now. First of all, really high in our minds is getting the puppies which are getting larger and wanting outside now. We want to get those puppies vaccinated so they can get out and about and socialised. So as of Monday morning, mainly Douglas and I, we're going to start vaccinating puppies with their first and their second vaccines, and of course any vaccines that lapsed. As we've said to our clients already, we're going to look after any top-up vaccines they require. We also want to vaccinate puppies that are due their first annual vaccine, so their 1-year-old vaccine, because if a pup goes late with that one, their immunity can dip quite quickly. It's going to be the same for kittens. We want to offer to do their first and second vaccines, their kitten vaccines, and their first annual vaccines, because again we don't want to let that lapse. If however you have kittens that are indoors, they're not seeing other cats, please ask us to do that once restrictions have been lifted a bit more. The other thing that we would like to do, and many of you won't have thought of this, but rabbits, we must consider them. It is reaching the peak myxomatosis season, so we would like to invite all rabbits to come in for their myxomatosis vaccines. As well as doing these things, we're still doing any urgent work, we're still doing any emergency work, and if you have a pet with something you think is going to cause them a problem in the next 2 months, please call us and ask for some advice, and we'll give you some tailored guidance on that. Okay, so back to Douglas.
Sure, be patient with us please. Glenn and I, as Glenn said, are doing most of these vaccines ourselves. The purpose is to try and protect our team and our other vets from coming into contact with more people and more puppies. So we're trying to protect our team as well as trying to get these puppies vaccinated. So Glenn and I have added extra appointments next week in order to get these puppies vaccinated as soon as possible, but please just bear with us. We will get you appointments, we just need a bit of time. We're going to continue doing what we do, which is a social distancing model for consulting. So we'll advise you when you get to the surgery, please stay out in the car park and telephone reception and we'll tell you what to do. Also be aware that if you are a high risk and you've been told by the government or the NHS that you should stay home, then you should do your own risk assessment and you should strongly consider not travelling to the surgery. Perhaps talk to family and friends and see if there's someone that can bring a puppy or a kitten or a rabbit down to the surgery to have the vaccine done for you. As Glenn says, we're still here, so if you've got any concerns about your pet being unwell, call us and we'll get you booked in for an appointment as normal. We're going to start working through our list that we have now of puppies that need vaccinated. If you don't hear from us in the next few days, then please call us and we can review and get you an appointment booked. Thank you again, and we'll speak to you soon.
Thank you.